Hi everyone, I'm Dr. Cole with Mid-Atlantic Chiropractic. Today we'll be doing an adjustment for Shaun. So Shaun, tell me a little bit about what's going on today.
I have a little bit of under the elbow pain and some low back pain.
Awesome. Well, not awesome for you, but awesome that I know how I can fix it. Shaun typically responds really well to chiropractic adjustments. We'll probably do some side posture today. So Mr. Shaun, why don't we go ahead and have you go on your belly here. So Shaun's on his belly. Now we're going to take a look at his leg length here. A little short, and by a little bit, I mean a lot on the left. Holy cow. His pelvic being unbalanced is likely what's given him a lot of mid-back and lower back tightness today. We're gonna go ahead and feel a couple of spots here. We're gonna go from lateral to medial, pushing in and pushing in. Pretty tight. Is it worse on the right side compared to the left side, or vice versa?
It's tighter on the right, but it hurts more on the left.
I see. Your listing there is a lateral flexion at L4, so that makes a lot of sense. And then let's see, any tenderness at any of these?
When you go lower.
Lower, okay. Number one, number two.
One hurt more.
Number one, number two.
Let's say one still.
Number one, all right. Let's have you go on your side towards me. All right, Mr. Shaun, so I'm gonna have you take a big deep breath for me. All the way out, good, good. One more, big deep breath. All the way out for the pelvis. Beautiful. And now the other side. So the first one we did was for the lumbar. Second one was for the pelvis. Now he's on his right side, and we need to do lower SI. So a big deep breath here. All the way out. Oh, my goodness. Let's have you go back on your belly. Very nice. Back to being even here. All right. So we can double check here. Any better on the left there, Shaun?
It's all kind of like radiating now, so I'm not too sure. It doesn't hurt as much now.
Where do you feel some radiating pain?
Kind of like here.
I see. Okay, so we're going to do some extension. That's the next thing on your listings. Extension. Good. So I'm actually have you scoot up towards the headpiece there. All right, you're going to take a big deep breath. All the way out. Good. And again, big deep breath. All the way out. And one more time, big deep breath. All the way out. One more here, big deep breath, coming out. That was a pretty big one. Any discomfort there?
No.
Good. Pushing in, is that any better there?
It feels better, yeah.
Good, good. Next thing we need to do is some flexion. So I'm going to have you go onto your back for me. So we'll be trying to improve his kyphosis in his middle to upper thoracic spine. So we're going to have you bend up your knees here for me. And we'll do the fingers interlocked behind the neck. I'm going to move the mic here. Good. Big deep breath. All the way out. Good. One more. Beautiful. I think we got them all there, Shaun.
Holy crap.
Then we'll have you relax your hands back on your belly. Any headaches, migraines, neck tightness recently?
Maybe neck tightness, if anything, not headaches or migraines, no.
So the listing says we should be tender around the C1. Is that tender there?
Yeah.
Okay. So we need to do a lateral flexion, occiput, and C1. And have you wiggle your toes for me. Good. That was a pretty big one.
Very nice.
And what about right there?
Oh, yeah.
All right, one more. Coming up and over.
Oh, my.
Those are pretty huge.
Huge. Very nice.
That feels better to me. Does it feel better to you, Mr. Shaun?
Night and day.
All right. Let's have you go ahead and stand on up and move that low back around and see how that feels.
Night and day difference.
Pretty solid? Awesome. All right, guys. I'm Dr. Cole with Mid-Atlantic Chiropractic. I'm glad we were able to help Shaun out with his lower back pain. If you or anybody you know needs some help with their lower back, we'll be here. Thank you very much.
Like and subscribe.
And like and subscribe.